Welcome to the Hit Like a Girl podcast, where with each episode we hear from different women experts in the health IT industry.
We like to hear about what makes them tick, how they overcome challenges, work they're proud of, advice they would give to other women in health IT, and much more.
I'm Joy Rios.
And I'm Robin Roberts.
We are talking with Danielle Siarri, the Inno nurse, and that's short for innovative. And that she is. Danielle has a master's degree in nursing and health informatics. She's a global healthcare and health tech citizen who's using her clinical and health IT background to travel the world. She's seen what other countries are doing every day, from birthing babies to integrating technology. She has so much to share, so let's dive in.
Well, I think life, you make conscious and unconscious choices. Like, I consciously made a choice to become a nurse. Traveling, becoming an ER nurse, getting my undergrad degree. I can still see being in Stanford and trying to put IVs in and making mistakes. And you don't know how your path is going to go as time goes. So working up in San Francisco, working and living, and then traveling across the U.S. And then I had this idea, why don't I go to other countries to see how they do healthcare and health technology? I didn't know that that was a thing. I didn't know that people, signed up and went to hospitals. And so I went around to about 35 countries seeing how they did things. And I'd ask them, can I come to New York? Can I come on this military installation base in Malmsteen Limestone? Will you let me on? And they did. And Belize, and just traveling around and see, how do you do it? How do you deliver babies? Like, how you deliver them in the ER? Oh, yeah, we do them, but this is how we do respiratory treatments in this hallway. And just kind of really trying to understand, myself as a nurse, how I relate to patients all over the world, because I feel like, you're a nurse for the world. It's not for one hospital or one block or one NT or one geolocation. You're responsible, for the world. So through that process, I discovered health tech was a real thing. And I didn't know it was a real thing. And as I pursued and checked things out, I discovered my master's at UPenn in nursing informatics and had a wonderful professor and just really put me on this path. And one of the things was learning how to use social media. I was like, oh, okay, I have to learn how to use Twitter. I'm getting graded. I have to set up a YouTube video. How do you film yourself? How do you set these things up? How do you build little apps that, can motivate people? And so this funnel path, I got halfway through. I said, okay, what am I going to create? I'm a woman of color. No one's going to give me anything. I need to go out there and take something for myself. So that's when I decided. I said, I can't find an accredited online library that's getting new information, like news articles, what new products should you see. And so through that process, I created InnoNurse.info. And the premise was, our teacher wanted us to do an Excel of our research. And I was like, well, this is kind of dead technology. No one's ever going to see my research this way. And this way I have a library where everyone can see my research and where I'm pulling information from what I write. And I just started to write about things that I liked. And people always say, do what you like. And it's like, well, how do you do that? What are you talking about? I'm going to go hungry. Give me a little more context with this. And I just kept my day job because I wanted to learn, how did case management work? How did coaching work? How did insurance work? Because it's not a piece that's taught in school. Because I'm not taught in school, I'm not going to be taught in graduate school. I need to go do this job and figure it out. And I did that at the same time with my graduate program because I felt I needed the bigger picture. And I wasn't just going to get it taking one single avenue. So it's been a process and a path.
So I said your piece of the health IT puzzle. You just articulated nursing at Stanford, traveling the world, learning from others, really absorbing other pieces of healthcare, health IT and technology, going back and get your master's, creating a library, creating apps, figuring out how social media works, which I need the help of my 14-year-old for, and Joy.
You have an accredited course in social media.
Yes,
so
and an accredited course. Thank you. So you have multiple pieces. Let's be honest. You are doing a lot of stuff.
It's kind of like trauma nursing. People accept you do multiple pieces, but when I tell people I do this and that, and they're like, so are you a nurse? I'm like, well, yes, I'm a licensed registered nurse. It says nursing informatics. And the great piece I got the other day I filmed in the nursing symposium, the presenter said, it's part of your Nurse Standard Practice Act to manage data. It's not like a job. it's kind of like your calling, your right to actual practice. You need to manage data. So saying that you're not good at technology, so I say, these things are choices. I didn't see my path when I started. There's no way I could know that I would be here. But I always knew that I wanted to see the world, and I have a thing where I have to keep at it until I understand it fully. And then I'm good. And then I share it, and I can move on to the next.
Do you understand it fully?
I think I got a big piece of the global puzzle. But I listen. I've learned sit back, listen. As some people say, I lie in the cut. I go, okay, all right, okay. Take it in, because sometimes people don't know who I am or what I can do. And I just listen. I go, okay. And I just keep adding it into the fold, because it's lifelong. You never stop learning.
No,
and health tech keeps evolving.
Yeah.
So if you don't, I always try to say 5 years ahead so I can keep like my own personal forecast of what's happening in the world. And I go to those places and embed myself for like a week, 2 weeks, a month to see how do people really live? How do they get their food? How do they get their water? Is their water clean? Is their air clean? How do they use technology? How do they function between their job and just how they live their life? How do they take care of their old people, their young people? How are like schools and kids? How does this all intersect together? So to me, you have to really go in and learn to come back to have a good perspective about what's happening in the world.
I feel like we both have a million questions hearing everything you just gave us. Joey and I are sitting here competing for questions. Wait, me.
Think big.
So you went out there with this openness to go do all this travel and observe and listen and learn, which is tremendous. What was out there that either you watched or learned from that surprised you most, either early on or maybe even something recently?
I would say 3 that come to mind. When I went to Belize, and I showed up at this hospital in Belize, and I knocked on the door. I said, can you let me in the ER? I'd like to see how you do things. And was never a white outfit wearing nurse, not even in school. We didn't have to wear them, West Coast. And so they were all wearing white, and the chargers came out and introduced me to everybody, walked me through like their workflow, their clinical workflow, how it works, how they charge, took me to their office, walked me through like, okay, we do our respiratory treatments in the hallway. We find it's great with open knees. We have a room we set up for maternity because a lot of people come in because they might live far out, and we deliver right here. And they were so warm and welcoming and inviting. I would say another one, going to Malta, was really eye-opening because when someone said, come to Malta, I was like, Malta? And I silly only thought was Crusades. I'm like, there's a lot of stuff happens since Crusades. I got to get there and see what's going on. Especially its geolocation next to Africa and close to Sicily. It's been like a global crosswords for thousands and thousands of years. So to learn about the first hospitals and hospital R being there, seeing some of the first hospital world, learning that flow had came through and said, hey, you got to clean this up. Let's do some stats and get things going. And to see, like, oh, I didn't know flow came down here. Oh, Crimea War. And to start piecing the ladders together and how first civilizations and how they were older in Egypt and how did they care for each other, what's been the process, of this arpeggio of these rocks. So to see health tech there and how they do it and creating all these like usable medical device wearables that actually work. And it's like, who knew what you would discover in Malta? So actually those were the 2 most surprising. Estonia was great. Learning, and people go, they're like, oh, Estonia, they think like Wi-Fi rains down. It's like, no, you have to go buy a chip, put in your phone, Wi-Fi doesn't rain down. They're very tech savvy, but you still have to go and get a chip.
So everyone has their challenges.
Everyone has their challenges. Spain's doing so much. The Nordic region is so far ahead. So I just go around learning about augmented reality a few years ago, before it was like a thing, on a little island in a skilled nursing facility in Norway. I'm looking around like, you're creating a library for the different body parts, for the therapists to work with the patients, and then the patients are competing for the stats. So yeah, okay, yeah, no, people not making libraries.
That is so
with game
cool.
systems and, using augmented reality and virtual reality. That was before I saw, anything was happening in the U.S., and I wrote a paper about it. So things like that fascinate me. You have to get on the ground with the people. I can't, be stuck in an office somewhere. You have to be where the people are.
I was just going to say one comment. When we first, and then I have to let Joy ask all of her questions. She's shaking her finger. When we first met you had running shoes on, and now hearing everything you just had to tell us, it makes sense.
So my question has to do with, once you learn all of it, and you've learned, you're exploring, you're asking, you're gathering all these findings, you're putting them back on inowners.info, is that right?
Mm-hmm. Perfect.
How is that information being leveraged? Are you able to connect with other companies that are using that information as like the intelligence of what they're...
Sometimes companies find me, sometimes I find them, go, oh, I like your product, I think it's interesting, I want to write about it, I want to collaborate, I want to do a partnership. And the ones that have known me, they're like, oh, great, someone might be new, I might have to be introduced to them. And so it's all different ways how people find me. I might, work in a rural population where they don't have a nurse informatics and help the nurses there so they can take care of their population. So everyone sees me like from different angles, and they might know me from images, or they might know me from writing or from a podcast. And so it's just different slices of pie. So it's a discovery process. And I think consistency. If you're consistent and you make a good product, people will come back.
Yeah, but your product is you.
Yeah, I'm the product.
Yeah.
And I would say, as a nurse, like you have to sell a lot of things, and not to sound, too nursey, but, you might have to sell something to someone that's uncomfortable. And you have to make them believe in you that this is for the best for them. And if you can sell somebody that's something they're like, I don't know if like I really want to do this. And you're like, no, you're going to feel better, we're going to do this. So if you can convince somebody of that, you should be able to sell yourself, because that's what you're doing. You're selling yourself. Your integrity or your ethics. People believe in you if you believe in yourself and you have confidence, and they see you consistently, staying on message of, sharing and caring and bringing information.
Our second question, I feel like, is such a loaded question to ask you, because
ready.
you are like the global fairy godmother of nursing.
I'm trying to live up to flow, but flow, that's a hard bar.
Okay.
It's a high bar. I have to get a PhD or something like that and cure something, but
You're doing pretty good. You're pretty phenomenal. That's an understatement. If you could snap your fingers and solve one problem in healthcare, health IT, what would it be and why? And you're like a global citizen now, so that's a huge ask.
In my heart, and I'm a nurse, I can't lie, I gotta say the truth. When you say that, the first thing comes to mind is I didn't know there was still a thing with women and men, and women getting paid more, not women. Like, you get 30% less, and I discovered I get 40% less. And I'm like, I'm doing the same work, I have the same education, and people don't have the same value in you. That's why when I created a brand, created an entity, they found value in that. But if I didn't have that brand and that entity, they're like, oh, you're a nurse, you use computers, what is that? So much like you have to package and promote and create yourself. You just can't do one thing. I think that's going to get it done nowadays. And just be aware that, women go into a project or going into a job and think you have to have 100% of what they need, and trying to over and do. And sometimes this might be a goal that they want, but necessarily it's like a unicorn. It's not a real person, where a man will go in with 30 to 50% of the qualifications and still ask for a raise. And when I figure that out, I'm like, I'm undercutting myself. I'm not asking, I know what I'm worth, but I have to tack on 40% of my worth to get up to the line.
Isn't that fascinating? Like, who teaches them that? Where do they get that?
I asked a couple men trusted about that. I'm all, I saw this woman and this man, and they both had similar jobs at the same company. And something dawned on me. I said, did she get paid less? He's like, yes, she did. I said, you said that so quick. Yeah, there was a meeting. I had no control of the meeting, but I sat in the meeting. And it was always like, well, the woman, she has this dog, and she wants to foster care. She eats quinoa, and, she doesn't really do that much. And, the other guy manages, people. And, I just, she's really not doing as much. And I said, did she get exactly 30% less? That she got exactly 30% less. So I'm like, the 30% is like a real thing. I went back to double check that it was in my head. I said, if you're brown, do you get less? I said, absolutely, you get less. You undervalue and the overworking. I said, okay, good to know. Duly noted. It
is a really important lesson to learn, is just knowing your value, knowing it's okay to say no, knowing to, we've been having a conversation a lot lately about, not undercutting ourselves, and it's not a race to the bottom because somebody else will do the same job.
And promote other people.
Yeah.
When I first came to him, I always say no one talked to me. The second time I came, and people kind of look at you funny, and there wasn't like a tribe mentality. There was no one like saying, hey, come along with me or join me. So the third time when I came, I was in graduate school, and I started using Twitter. And then because I can write in Spanish, someone said, hey, I'm coming from Europe. And I met Australia online. She's like, let's meet up. I know some people. So she's coming from Europe. I'm coming back into my own country, and she's introducing me around. So I feel like if you're a person of color, and it was true when I was a musician, it's almost like you have to leave and I made my name in Europe, and then came back to my own country. And I had to be reintroduced by other people from outside the country for people to know who I was. It happened even recently at J.P. Morgan Chase. I'd let someone know. I said, "Hey, I'm going to try to apply for this fin and do press," and they got it, and I didn't. And they're like, "Danielle's from the Bay Area. She's from Cupertino. Like, her family's been here since 1940. Like, how is she not on the list?" And I'm on the list. And nobody there knew who I was. I said, I grew up here. I went to high school here. I went to college here. I worked here at multiple hospitals in the community. And it's like, no, we don't know who you are. Okay,
But is the secret Twitter? Is it like? Is that part of it? That it's people feel like, they're not that you're not real unless you've got a presence online somehow?
I think that's part of the case until I really started using Twitter and Instagram and building a community there, online, and then offline. It's like, oh, hey, it's Nurse, here's Danielle's here. But prior to that, nobody will really know your name, and so I had to make a name for myself.
You brought something up, and I'm just going to say you've traveled the world, and you just called out basically gender, racial, and ethnic inequality in America in a really big way, but you've traveled to all these other countries. Do you see anyone that's, let's just say, getting it as wrong as we are? Right? Because you said you left and it goes better in other places, or do you feel like
race is a thing? It's almost like you can't escape. But it's see, in France, there is no race column. It's either you're French or you're not. You speak French or you're not. Period. And when I show up in Spain, it's oh, great, Danielle's back. Let's have a good time. And so, or you go in the Nordic region, it's the same. They've had a lot of policies in places for hundreds of years, say in Sweden or something like that. So the gender equality is a lot closer. The pay is a lot closer, and they do a lot for maternal and parental leave. It's they pay a lot in tax, but they get, a lot back. So here, I think because we've had such a history of how we develop, it's not quite the same. So I'm not saying it's perfect in other places, but when I show up, I'm an American. I'm the American nurse that's coming to town. Oh, Danielle, we put her with the Swiss and the Germans. We claim her. Canada claims me. Spain, everybody claims. Oh, no. Danielle, she's not a regular American.
Well, let's talk about claiming you, because you also said, and I'm so sorry to digress way back, but you said you just showed up at the door of some of these places, or that you just asked to go along.
Please,
so
did you just far?
It sure does, and I tell my kids manners are free and everyone can afford them.
Yes,
I don't care who you are.
Yes,
high five. I'm so glad to hear you say that.
Humility. Please,
so
thank you.
So did you just ask? You went and created these opportunities for yourself?
I just showed up and I said, hi, my name's Danielle. I'm an American nurse. I can show you my license credentials, and I really like to see how you do things. I really want to learn. I didn't know that there was hospital tours. I didn't know that was a thing. I just showing up and doing it on my own across the world, and people would let me in.
So just a self-driven learner to go figure this out.
I find local population, go, hey, I would like to see your local hospital. Can you take me in and translate? People go, sure, let's go. Which one? Oh, this is a great one on the island. Let's go with it. Great, thank you.
That is so cool. It's just so freaking cool.
Self-directed world tour where,
through a lot of aspects of healthcare.
You have to be a go-getter, and no one's gonna give me anything. I have to go and start putting my own little nuggets in my basket. And so it's funny when I talk to people that don't know me and I try to explain. They're like, oh, you're a nurse, you use technology. Yeah, I use little technology a little bit. I think I got this down, but they can't think beyond. It's almost like when they hear nurse, it's like a stigmatism to your intelligence, which is kind of fascinating. So if I'm in certain countries, it's like a vocational job. But if I say, I'm an American nurse, they know that we do a lot more. But I say they could do a lot more if you allowed them.
Yeah, I gotta say, my initial intuition and thought when you say that, though, is a consumer in healthcare, only in America, and being a parent and myself, our son who had a very rare disease, and basically living in hospitals for so long, that I observed the nurses telling, especially in the summertime, right, when the doctors are all over, you have these new students coming in, you have the nurses delivering the prompts to physicians in emergency rooms. You have them running the codes sometimes before the doctor can even get into the room.
Yeah, the nurses are in charge in the U.S., which is odd in other countries. They're not.
But, so you say it's an insult to the intelligence that you do that. I think what I've observed here is just really and it's so fortunate, the shortage, the ratios, the everything, because they bear so much of what goes on in our healthcare system.
You have to communicate to everybody. You have to talk to environmental services. You have to talk to dietary, the doctors, the patients, like everybody, and talk to them in a way that they understand. And that's the same with nursing informatics. I could talk to the medical economics. I could talk to, not just the business side, but the IT, the project managers, to explain everything. And then people still don't get what nursing informatics is. And I'm like, okay, how do I slice this pie? To grasp that, like, it's not a singular thing. And so that's what I really try to create, a whole kind of, I don't know, like a web. And show how it's all connected. It's like I'm doing project management because I'm managing myself. I'm managing my schedule. I'm managing where I'm going. I'm doing the business. And someone looked over at me the other day and says, do you realize all the work you're doing is like a work of 5 people? I said, really? No, there's whole teams that just do what you do. Like, you're filming, you're writing, you're traveling, you're speaking, you're writing up courses. Like that's not an everyday thing. I said, well, I wish that could translate out so people could see that what we're doing, it's the norm, and just respect that all these pieces you see are real things. It's not just like a gloss over.
Well said. That's really well said.
All right, last question.
Okay.
We are building a reading list for our listeners, and so we would like to know if there are any books that have been impactful to you, either personally or professionally, fiction or nonfiction, that you think women in health IT should be.
I'm a nerd.
Good.
It's terrible.
Geek out with us.
Geek out.
On my desk right now, I would say the 2 books are, there is like it's like secrets to nursing informatics. So I'm always reading in the chapters and reading through and preparing for the exam. And then, I don't know if you guys know Prashant, the big CXO. He has an AI book. And so I keep that on my desk, and there's case studies in there, and I'll flip through the case studies and read like different sections and kind of keep my mind fresh and what to think ahead, what companies to look for, and keep myself on the process.
All right, so that was really 2. Cool. 1, the nursing informatics, is that the title of it?
Yeah, it's like a nursing informatics, secrets to nursing informatics.
Thank you. Secrets to nursing informatics.
And then I'll give you the link to Prashant's book. It's like deciphering AI. I can see the picture in my head, and it's sitting on my desk. So those are my 2 like flip throughs.
Okay.
Is that fair?
That's perfect.
Okay, good.
All right. Well, if we could even catch up with you, where is the best place to find you? What is the social media
like
links?
Physically, or
I don't know. This is like, where in the world is Carmen Sandiego? I don't know what this is.
I am the Where's Waldo.
Where's Waldo?
I just kind of pop up somewhere, and there I am.
Well, we are just so fortunate to sit with you in person. But if they want to find you online or know more about InnoNurse,
Twitter,
what is the best place?
it's InnoNurse. Instagram's InnoNurse, and the website is innonurse.info.
Excellent.
Easy peasy.
Easy peasy.
All right.
Keep the branding simple.
That's great.
Danielle, I am just in awe of everything you just shared with us in
this
this short
for your time.
No.
I know we all have busy lives and we're not perfect, but one can only do their best.
Well, if one can only do their best, I think you're doing pretty darn well. So, thank you.
Thank you both.
And thank you for listening to the Hit Like a Girl podcast. If you want to know more about us or this guest, check out our website at hitlikeagirlpod.com.
While you're at it, if you found value in this episode, we'd appreciate a ratings on iTunes. Or simply tell a friend. You can also connect with us on Twitter or Instagram at the handle hitlikeagirlpod. Thanks again. See you soon.